Welcome to Fit Fun Abs, our podcast on drug checking research with Danilo, Katie and Sam. If you'd like to introduce yourself, I'll go to you, Danilo, first.
Sure. Thanks, Sam. So I'm Danilo Falzon, and I'm a research assistant with the Salvation Army Centre for Addiction Services and Research, otherwise known as SACASR. I began working there as a volunteer in March 2020 and then got a paid role later on in that year, and I've been working on the drug checking project since the start of this year. And I'm glad to be here.
It's great to have you here. And Katie?
Hello, I'm Katie and I'm a Health Improvement Officer for Aberdeen City Health and Social Care Partnership. So my role is really diverse and I get to engage in lots of different activities such as health inequalities, work with third sector groups like SAM. So I'm really happy to be here and hopefully all the podcasts go well, Sam.
I'm sure they will. Let's think positive. We're looking into, obviously, the research field. You've mentioned some about it there, Danilo. Could you elaborate?
Sure. So as I mentioned, I'm working on a drug checking project, which is funded by the Drugs Test Task Force, and it's a Stirling Uni. I should say SACASR is part of Stirling University. So it's a Stirling University project working with partners. So we're doing a few different things in the project, but basically our study it's looking at the barriers and the opportunities and the kind of acceptability and feasibility of implementing drug checking in a Scottish context, focusing on Aberdeen, Dundee and Glasgow. And to provide some basic background information about drug checking, that's a service where somebody can hand in a small sample of their drugs for testing and receive some information about what's in the sample that they've submitted and some wider harm reduction advice. So as part of the project, we're doing kind of two main pieces of research. So the first is a qualitative piece of research, and we've done 43 interviews with various stakeholders in Aberdeen, Dundee and Glasgow. So this includes professional stakeholders, and that's staff from the third sector, NHS and police. And we've also interviewed people who are using drugs or have done so in the last 12 months, as well as family members of people who are using drugs and have done so in the last 12 months. And we've been speaking to participants about a range of different factors, including sort of service design and delivery. So where does a service need to be located and what does it need to look like to meet people's needs? Who needs to be involved in the planning and implementation of drug checking, and also whether there's a need for drug checking and what the main benefits of drug checking would be. And just briefly, the kind of second piece of research that we're doing is a literature review. So we're looking at the international evidence around drug checking and considering how it fits with a Scottish context. And as well as this kind of research side, we're also working really closely with local implementation groups who are considering how to set up drug checking in each of these three cities. So we're kind of facilitating dialogue between key stakeholders and trying to share information and evidence as widely as possible to help inform implementation. And I would just say that it's important to note that our research team, we're only kind of developing the evidence base around drug checking. So the actual setting up of drug checking services, that's the kind of preserve of the local groups that I mentioned.
That was really interesting. Quick question, have you faced any barriers or challenges in implementing the two research projects?
Sure. Well, as I mentioned there's a lot of different topics that we're trying to consider. It's quite a complex issue with a lot of different moving parts. So, you've got the kind of legal challenges around drug checking, exists in a sort of legal grey area as such. There are, it's trying to consider what drug checking needs to look like and where it's set up is also a surprisingly complex task with lots of different little bits. So just trying to pull all of that together has, I suppose, I wouldn't say it's been a barrier, it's been a challenge and it's part of the research process. And recruitment is always a challenge, emailing people, chasing them up and stuff, but we got there. And so no, I would say it's gone fairly well so far, but it's a complex thing with a lot of different stakeholders in dialogue and a lot of different things to consider.
Yeah, a good challenge.
Yeah.
That's it.
No, definitely.
Yes, sorry, I do have questions. It sounds really positive. I mean, it's something to me is really exciting. Coming from my side of things with lived experience, I think it's great you've embraced that, in the studies and utilised that. Katie, I don't know if you wanted to elaborate more. I know you were keen to bring it up.
Yeah, I think it's vital. I think you see quite a lot organisations don't really sometimes work with people who have the lived experiences, so I feel sometimes their voices aren't represented in services, or like, for instance, like harm reduction. I think the people with the lived experiences that are in recovery and stuff have such an influence. I think they should have such an influence of what is getting done and what prevention strategies or what interventions we can put in place, because they've been through it and they know exactly, like, the emotional side, they understand it, whereas I can do all the reading, but I'll never really truly understand what it's like to go through prevention interventions, the good days, the bad. I can't understand it, but I can understand it as well as I can try to, but I'll never truly get it. So I think, I'm a big advocate for making sure people's lived experiences are a key part of that.
Absolutely. It's so important, and I couldn't agree more. Of the 43 interviews that we've done, 15 have been with living or lived experience.
Mm-hmm.
So there's been a slightly heavier emphasis on professionals in the stakeholder side. Perhaps not by design, but just by that sometimes that's the way recruitment happens. But I should actually say that we also do, and I omitted to say this, we have a kind of lived experience group who work really closely with the research team. And the point there is to be kind of feeding in all of those expertise that you were just discussing there, Katie.
Mm-hmm.
And you mentioned there, like, people with living or lived experience really understanding the experience of that, like what that's like. And you do notice that in the data, where professional stakeholders may discuss resources and all of these considerations around stakeholders who need to be involved. A lot of the living and lived experience data is directly quite raw about that experiences that people have lived through and what they need to, help them and support them, and the kind of systemic change and things like that.
Do you have, like, so when you're, speaking to people's lived experiences, I can imagine it, one of my worries maybe would be, I don't want to trigger any, like, behaviors or just, like, bring back bad memories from the past. Has that been really challenging in conducting interviews or different things?
Well, it's always something that we need to really be mindful of when we're doing research. We're asking people about their experiences, and as you say, that can really bring up things which are emotional or painful. So I think one of the things is just trying to be as sensitive as possible.
Yeah.
And sometimes saying, I'm asking this question, just share as much as you're willing to share. And oftentimes you find that people want to share these experiences because it's really important that they're heard. So there have been a couple of occasions maybe where people can get a little bit upset during interviews, and obviously we'll switch off the recorder at that point. We'll just have a conversation and try to be there for that person. And then if they want to continue, then they do, and they have. And another thing that we do is, after the research, we send an email with a document called a Debrief Sheet. So that just outlines various, like, support organisations that people can access, and it also kind of acts to keep a channel of communication open between the participant and the researcher. Like, we don't want it to be that we've done the interview and then we're shut off, see you later, we've got what we need. You can come back, you can ask us questions, like, it's kind of more of an open channel and trying to be supportive.
No, that's really good. Do you want to go into, should we move on to the next question, Sam? Or?
Yeah, no, that sounds incredible.
So good.
It's great to hear of things such as that. I don't know if we could perhaps, if it's of interest, look at similar sort of studies and projects and successes, in different areas or countries even, Danilo?
Sure, absolutely. So drug checking itself actually has a longer history than a lot of people think. And it began as a kind of grassroots practice and was pioneered in the 60s and 70s in North America. And it was seen very much as a form of harm reduction at nightlife and festival events through the use of kind of more basic testing equipment. Through time that's developed in the 90s and early 2000s, drug checking began to become established throughout Europe. So this was the result, I suppose, of the increasing popularity of synthetic drug use like ecstasy, used in, again, nightlife and festival settings. And so the longest established and probably best known of these European services is the Drug Information and Monitoring System, DIMS, in the Netherlands. And that's actually a state-funded drug checking service. And to date, this service has tested hundreds of thousands of samples and is quite an established part of the harm reduction architecture in the Netherlands. So since the establishment of these kind of early services in Europe, I would say that the popularity and interest of drug checking as a harm reduction intervention has really continued to grow. So a review in 2018 found 31 drug checking services across 20 countries, and I wouldn't be surprised if that number has grown again in the last couple of years. So most of these services are in Europe, but others are in South and North America, as well as Australasia. So we're starting to see it spread globally. And I suppose it's worth noting that these drug checking services, they vary very widely in terms of how and where they operate. So for example, some will just visit various nighttime events or festivals and offer a particular service on that day. Whereas others, like the service in the Netherlands that I mentioned, that's a fixed site service which is available, all or most of the time. And I would say that these services in Europe have typically been used by kind of younger people, often people in education and employment, with relatively high levels of, to use a kind of research speak, social integration, if you will. But in Canada, there's been some very interesting developments over the last few years in terms of the emergence of fixed site drug checking services, which are catering to a more diverse client group. So that could be people at high risk of drug related harms who are often facing kind of a lot of issues around trauma, mental health, poverty, marginalisation and homelessness. And obviously this is a very relevant development in a Scottish context and something which we've been looking at closely, because there's similarities there in terms of the Scottish context. There's there's high levels of drug-related harms and deaths in both countries. And there's a need to think about how to tailor these services to be suitable for people who may be facing a lot of structural risks and disadvantages. And not to go on too much, but there's been a couple of pilots in the UK and a couple of interesting developments. So the Loop have been providing drug checking in some festivals in England since 2016. They've also undertaken a community pilot over 5 days in Bristol and Durham in 2018. There's been a pilot in Weston-super-Mare in 2019, which took place over 4 days. And I would say both of these pilots were well received and had promising results, but obviously were over quite short periods of time. And there are also things like the rather snazzily titled Welsh Emerging Drugs Identification and of Novel Substances, aka WEDINOS, is a bit of a mouthful, which was set up in 2009. So that's a postal drug checking service where people can post in a sample of results, it's tested, and then the results are put up on the website. So there are no services currently in Scotland and there have been no pilots. However, I would say that anybody who's listening who would like to submit drugs for testing, WEDINOS is available to people in Scotland, and you can find out more information on their website or perhaps through a local service. So that's kind of a whistle-stop tour of some of the services that have been set up, and there's a lot of research going on alongside that.
No, I was just going to ask, this I guess is an open question, but to both. But why is Scotland's drug checking services not at the same stages as like the Netherlands or all the other like examples you gave? Do you think, I don't know, Sam, for you, if how much knowledge you've got around this one, but I just don't really know why we're not at the same stage or as good as other countries, because we are a high income country and there's such a prevalence of drug abuse, and it's definitely increased because of the impact of the pandemic. And I think, I just think there's more maybe support needed around that area in Scotland then. I don't know if you agree or...
No, absolutely. I mean, I agree from my point of view. I mean, Danilo, I think, will have more answers, but I guess from my viewpoint, looking back at things, and granted things are changing immensely, but there's very much, or was very much, a war on drugs. And I think even though things are changing, that's still in a lot of people's minds and heads, and that almost stigmatic law, if you like, in a way, affects so many people, so that things aren't perhaps encouraged, like holistic things, testing, counselling, all these other options, or looking at complex needs and trauma, because there had been that initial attitude, just stop the drugs or just put them in jail, and then they'll stop the drugs. But obviously it's 50 years on now. Things, need that sort of change. Danilo, do you think?
No, absolutely. Just second everything that you've said, Sam. I think that, it's interesting to note that harm reduction, as you've touched upon there, drug checking, as you've touched upon there, it's really underpinned by a harm reduction and a rights-based philosophy. So not everybody is going to stop taking drugs, and also people take drugs for a large number of reasons. It's really a part of our society, and so what we've seen is that we've been keeping people at kind of arm's length and denying them information and support unless they stop using drugs, which you've alluded to there with the war on drugs, and arguably that does create a lot more harm than good. So I think it's part of the reason why, as you say, we haven't got there yet, although things are changing, is that it requires that underpinning kind of value shift, almost is a kind of cognitive shift in the way you address people who use drugs and drugs themselves.
Quick question again, what do you mean by like the way you approach people? Just so I've got a bit of...
So like as Sam touched upon there, there's a lot of stigma, and there is a kind of othering of people who use drugs, and that's reflected in the policies and the practices in the way that we've approached people. Support has very much been conditional on stopping using drugs or a variety of different things. We've criminalized drug use. So I think all of these things are they require a different view. They require a kinder and more compassionate view, and one that doesn't other people and recognizes that we're all vulnerable to structural and social forces in our life. And I think the pandemic has showed that we are all vulnerable to biological, social and structural forces, and we're not always in control of the things that happen in our life. So I think recognizing that and just seeking to support and value people. I don't know if that's too woolly an answer, but
no, I totally understand it in terms of when I was a student in university and stuff, you were kind of just exposed to all these different environments, and especially if you're, God, I can imagine a first year student and you're exposed to all these exciting new things, it's so easy to kind of get pulled into different environments because it's new, and there's a lot of peer pressure, stigma around drug use, and it's if you go to certain places, for instance nightlife, if you go to certain places, there's it's seen as you have to kind of take drugs to go to that club type of thing. I don't know if that's normal, but it's just there's just these environments where there's so much pressure to be and act a certain way, and it's so unhealthy, but it's almost it is the way it is. And I think it's been like that ever since I started working and being a student in Aberdeen. It's never changed, but it's always been if you go to certain clubs, it's just that's what everyone does, because that's just the norm.
Sure.
And it's like those kind of environments, and yeah, it's not ideal.
I think, like you've touched upon there, that kind of drug use is not something which is confined to. So when I said like othering of people use drugs, it's not something that's confined to one section of society. Drug use is throughout society, and so we need to have more honest conversations about increasing drug literacy and helping people manage and reduce harms and risks, whatever situation they may be in. So whether that's using drugs every day, or whether that's using drugs only at the weekends, or any combination of the continuum between that.
Yeah.
And I think that's one of the things about drug checking, is it can help increase that drug literacy, and I think it's really important.
No, definitely. I totally agree.
Yeah, I mean, that makes a lot of sense. It's interesting, especially what both of you are saying, and from different points of view, and perhaps listeners can attribute, their own views, and get that. I guess that changes are happening and coming, and it's examining these stigmas or these attitudes. It's something which is ongoing. It started, and the more we can continue conversation, or open conversation, the better, in my point of view.
Absolutely.
For me, yes, I think it would have been a benefit for me during my times with dependency, going through those. But also, another thing I like to say, and perhaps for Katie as well, is it's also about that engagement. I know you've touched on it, but to me, any sort of engagement with someone willing to listen, or any sort of engagement is great to get a conversation going, and start that positiveness, as opposed to the closed door, or what I used to get, don't invite him round, he's XYZ, There's a lot of closed doors, or there can be attitudes such as, look, we'll give you, and this can come from amazing parents, amazing friends that perhaps don't understand where things can go to, but there can be, people saying, look, you've got one last chance, that's it, we'll cut you off, we'll throw you out the house, to those extremes. And that can be a really kind, caring family, just not understanding where those things can progress to.
I think one of the other things that'd be interesting is like the statistics of drug deaths, overdoses for Scotland, and just like the general overview of that area and harm reduction. If anyone's got any facts around that area.
Sure, I can go. I'm sure Sam knows in more detail than me, but I had to look up at some statistics. So I suppose the statistics for 2020 show 1,339 drug-related deaths in Scotland, and that's approximately 2.5 times more drug-related deaths than there were in 2013. So a 250% increase, I think, although I'm not great at statistics. But so Scotland has the highest drug-related deaths rate in the UK and in Europe. And the Scottish Affairs Committee at Westminster has actually called on the UK government to declare a public health emergency. And in terms of trends, so 93% of deaths, in 93% of deaths, there was more than one drug implicated, often with many drugs implicated in the death. So the most commonly implicated drugs were, in order, opioids, benzodiazepines, gabapentin or pregabalin, and cocaine. And I suppose it's really worth highlighting the huge role in the rise of drug-related deaths which benzodiazepines have played. So in 2015, they were implicated in 8% of deaths, but in 2020 this figure had rose to 66%, which is quite staggering. And deaths involving cocaine have also seen a drastic rise. So they're now implicated in 1 in every 3, as opposed to 1 in 20 in 2012. And the last thing I would say is that drug-related deaths, it's not evenly distributed distributed throughout the population. So this, the cost of this and the social cost of this has really disproportionately impacted those living in the most deprived communities. So the harms in the public health emergency, it's not something which is affecting all communities equally.
I guess in terms of like similarly with Aberdeen, it was in March this year. It was Aberdeen City Alcohol and Drug Partnership. They issued an alert to the rise in drug-related deaths. For instance, like in March, there was 10 suspected deaths that were recorded compared to there's normally an average of 4 a month. And there's like a risk of drug-related deaths that have been related to like the multi-drug use, especially with the illicit, I'm going to say it wrong, benzodiazepine. That one, I can never say it right, because a lot of them, they're kind of getting mixed with different substances. So that's like one of the worries in Aberdeen at the moment. There were some really interesting statistics, and I'm going to skip to the one that caught my eye. So like the number of drug-related deaths by single year in Aberdeen City. So in 2006, it was number of deaths were 26, and it's increased, and this is the highest it's been so far. In 2020, it increased from 26 in 2006 to 56 deaths in 2020. So there has been like an increase as the years have gone on, which obviously is not good. And then for like drug-related deaths, so age standardized rate per 100,000 population, ours is like significantly increased from about like 2014 to 2020. It's significantly risen, and it's now above like the Scottish average. So it shows that this is it is a huge issue, and it's just they're all just having that just sharp incline in the past 5 years, specifically like the last few years, and it could be due to the impacts of the pandemic, and there's so many additional stresses and pressures on people that are already vulnerable. I think it puts a lot more people into additional vulnerabilities and pressures, and like a reliance on alcohol and drugs to kind of get through challenging times.
Sam, I know I'm not the one like asking the questions or chairing, but I was wondering, as you're somebody that's kind of on the ground meeting people every day, what are the kind of things that you're seeing and the key challenges, and especially in relation to like Katie mentioning COVID and things like that, like what are the daily experiences and things you're coming across?
Well, I can actually pick up on one. Unfortunately, it's a good example of an incident which happened with us, with Fresh Community Wellness. We were in the process of training volunteers, helping. At that time, we were allowed out during the lockdown, the second lockdown, to help people, vulnerable people on the streets, etc. So we were doing our training around there. And in the centre of town, an incident occurred right beside Marks and Spencer's, a really busy place. And we were just in the process of signing in, if you like, for the start of that sort of welfare session. And I tend to see things going on, force of habit. And I saw, a head bobbing, and then I saw people swerving to avoid this person. I found it a little disappointing, but we went across. Well, for me, that's just second nature. If someone's, going through any sort of difficulty. And that was an example of benzos, as mentioned. And what had been tending to happen is people who were out on, and this is not everyone who's out on the streets, but a portion of them were struggling financially. That there wasn't that traffic that there might usually have been. So whereas before they might have just, I'm saying just, but might have gone for a drink, they had started to do things like pool money together so that they could then buy, say, 1,000 tablets, which unfortunately now the prices of which can be, 50, 60 pounds. So that was going on, and we were looking after the person, and her partner at the time was getting a bit, irate that we were helping her, but at which point the partner collapsed as well. So that ended up being, two lives that sort of highlights what's going on, and what we're seeing is that rise, as you mentioned, in things such as benzos and that poly drug use that could have led to something else. That mixture of alcohol and COVID has definitely shaped that. But also, I mean, the other thing I'd like to say regarding figures, and it's only my opinion, but being on the Drug Death Task Force, there's a lot of good work that has come out. So I think something people perhaps, I know any loss of life is tragic. A rising figure is got to be looked at, but we also need to remember that figure may well have been, far, far greater than that, had that work not been put in by not just the task force, obviously all those stakeholders involved, and with things such as naloxone being rolled out, that is helping. So yeah, I think for just now, that's certainly caught my attention. It's something that is still ongoing, and can be, unfortunate as these things do, even when situations are back to normal, because someone's used to taking something, especially something like a benzo, it's hard then to come off of that, even if they may have previously, returned to alcohol without that sort of intervention. And again, I guess, that perhaps a great opportunity for things like drug checking, where, we could be saying to them during outreach, do you really know what's in it? There can be that encouragement and motivation to perhaps then go to a drugs checking service.
Sure. You had actually told me in a previous conversation we had, Sam, that at times people were kind of like maybe even losing periods of time when they'd taken these benzodiazepines because they hadn't appreciated quite how different the strengths can be, that some can be very, very strong and things like that. So as you say, I think drug checking could help in that regard, around just helping us all understand, and people understand a bit more about dosages and strengths and kind of what they could expect in something and what the effects might be. So I think like increasing that drug literacy and having those conversations, and frontline workers and outreach being able to talk to people, backed up with the information that drug checking can provide us, I think is a real potential benefit.
Just to add on to that, there has been quite a lot of work recently in Aberdeen City, and it's specifically within the local outcome improvement plan, which is part of the Aberdeen City Health and Social Care Partnership. And there's been a lot of work kind of around early intervention and prevention treatment. For instance, there's quite a few different kind of improvement project ideas. So one of them is increasing the number of alcohol brief interventions delivered by primary care providers, increasing the uptake of alcohol treatment by providing access to alcohol services, and ensuring they're local, integrated and targeted areas. What else? There's quite a few, which is really, it's really needed. Reducing the incidence of fatal drug overdose through innovative developments, and increasing distribution of, I'm going to say it wrong again, naloxone, I can't say it. But yeah, it's good to see there's quite a few different improvement project aims in Aberdeen City to kind of target the issue with drugs. But there is more, but I could go on for a while. But it's good to know that work is being planned at the moment, and a few of them haven't been implemented yet, but there's different groups within Aberdeen City and around Aberdeen City that are focused on these different specific project aims. So yeah, it's just showing that it's really needed.
Yeah, I know. Thanks very much, Katie. And it's good. I think it's fantastic news that there is that eagerness of stakeholders, and not just stakeholders, organisations, people, communities coming together and really bringing back that community spirit, if you like. If you see someone struggling, that first, instinct, if you like, isn't to swerve and avoid. Perhaps now it can be more, making sure the person is okay. And there's different ways, I guess, of doing that. For people getting involved, again, going back to my times through that and lived experience, I think being noticed for something, whether it's when I was struggling or whether it was something positive, just being noticed at all. At times you almost feel invisible because of the attire and I can't, perhaps the way I was looking, people would avoid you. And that all then amplifies things such as mental health, such as trauma, etc. And yeah, it can be scary. And with the tablets, I think the rise you mentioned, Katie, was during, I think there was a batch of Xanax. We got a warning through from Craig and the team in Dundee that there was some bad batches going about. And I mean, that's the same for, most benzos, that forgetting, but with those ones, it was, 2, 3, 4 days. We've had someone from who came along to Fresh who experienced that quite often. Just a loss of days, that unknowing of what may or may not have happened. And in some ways he was, I suppose because he was male, he felt a bit more comfortable, but we have to remember, drug use has no barriers to any sort of gender identities. And should that, it can leave people vulnerable. That can be a really scary thing. And as you say, having that ability to have them checked, and also having that, that engagement and the intervention and the opening of doors as opposed to closing of doors is so important.
Just to touch on the engagement that you're talking about there, I think there is a kind of, from the interviews that we're doing and from other evidence around drug checking, there is a real sense that drug checking, as you say, can really aid that engagement, particularly maybe amongst people who aren't in touch with services or who may have a mistrust of services. It's a kind of way of saying to people like, well, we value you, we want to give you information, and it's like a very subtle shift in the way that things are done, which maybe over time can help build trust, and I think that's really important, and also can help engagement with like wider wraparound harm reduction supports. So it's not just here's the results of your drug checking, that's you, off you go. It's more of, what's going on for that person holistically and things like that. So I think it is a real tool for helping with engagement.
Definitely. I feel like we've kind of touched on like what other countries are doing in regards to drug checking projects. So the next is just kind of like, would this be of benefit to you during your times of dependency?
For me, yes. I think I've sort of breached that, but 100%. I think any opportunity that was open to me would have been a benefit to me. At different stages, my experience spanned quite a few years, during which a vast amount of the time I was deemed to be okay because I was working. That, in fact, made things even worse, because essentially you shouldn't be looking after or running projects on things such as oil rigs, when you're under the influence of drugs such as heroin. But at that time, when I would go through withdrawals and work and then come back and I would go to services, but I was almost always in those days told, actually, no, the test is clear, you're fine, move on. For me now, years and years later, it's great seeing that that's not the case. You can go in and say whatever the problem might be. So that shift in attitudes, I noticed in my short experience, has changed greatly.
That must have been so difficult going through that, like really on your mental health, because it almost sounds quite lonely that you just kind of got the okay, but you were never provided the emotional support that you should have been given, because you really shouldn't have had to go to work. And yeah, I just think that would really trigger, or I could imagine it maybe triggering, I don't know, I can't imagine that being really good in your mental and emotional health.
Yeah, absolutely, Katie. You're right. It's not, and it wasn't. Unfortunately, it got to the point where, as we know, I ended up being paralyzed. Multiple near deaths, and that rock bottom I had to hit before I could move on. So I guess I suppose that's where the passion for things such as fresh community wellness and things being that sort of passion for me at engaging with everyone without, with a group that's fully inclusive so that we're able to speak to everyone. An example is at times there can be, a few people attending, there can be more, but almost every time I'm out, it can be up to 30 people you're speaking to. That's in our area, which is a priority or deprived status area. I can see are struggling, but there is that engagement. And I think, as you brought up, there's quite a few that haven't or have been to services but aren't at present. So there's certainly scope there, and there's certainly interest I was gathering from that. But again, I guess it's building up that confidence. I sort of noticed that even in the short span, even though some of them knew me from years before. So I use that as a tool to be able to help others. I've opted for a very visible recovery. I completely understand people that don't push that. It's whatever works for you. It's got to be what works for you. And everyone's got different ways of doing it. But yeah, I think that built up trust. And then also speaking to people, or when I was finding people for things such as the interviews and such like, I think that there was still a bit of that there, who's the next call going to be, or who's turning up? And that was quickly broken down because of, you and the team's reassurances. Final thing I'd say on that is policing attitudes are starting. Obviously, it's got to be within the confines of the law, but attitudes are changing.
Thank you for sharing that, Sam, because I'm sure it's not the easiest thing to kind of speak about, and I can imagine it just being so bringing back emotions. And so yeah, thank you. And Danilo, I was just kind of wondering where kind of your project is at now, and if there's any specific results that are shining through so far, or if there's been positive outcomes.
Sure. So where we're at just now is, as I said, we've completed the interviews. We've done the bulk of the early analysis, and we're starting to kind of write up our findings and think about what these findings mean in relation to informing the setup of drug checking. So we're providing information to those local groups, and then we're going to be writing up more formal findings and hopefully sharing that as widely as possible. We're working with the lived experience group that I mentioned, and hopefully producing a creative output in that group, which will help share findings and key themes about drug checking. And I think in terms of findings or things that are shining through, obviously, as you can imagine, 43 interviews produces a lot of and we've asked about a lot of different themes, so it's producing a lot of information. It may be too much to kind of pinpoint key findings at this stage without going into a lot of detail. But I would say that it's really evident from the interviews that there's a real desire to see drug checking implemented amongst almost all the participants, lived experience and professional stakeholders. And I think there's an acknowledgement that we need new approaches with a different underpinning logic. And I would say that drug checking probably needs to think about how it can build the trust that Sam's been talking about and break down some of these barriers. So that's around policing, around having drug checking in trusted sites where people feel that they can go, and also using outreach as a means of communicating results to people. So it's not just that a person brings in a drug and is communicated the result. We need to think about how we can use that information spread it as widely as possible. So yeah, I think there's a few different things. And in terms of successes and stuff, I think we're still at an early stage to talk about successes, but I would say that the number of key stakeholders that have been involved in dialogue and trying to work through some of these challenges, I think that is a success in itself. And I think there's a real desire to see things like this come to fruition and really to see positive change. And I think there's a recognition that this situation is not, can't really go on. It needs to be addressed, basically.
Yeah.
And you know, we've been doing interviews with police participants, for example, and I would say that Sam touched upon there's a kind of shift in culture. I would say definitely that has come through, albeit from a small sample. There is an understanding that we perhaps need to do things a bit differently.
No, that's really interesting, and I feel like you kind of did cover like potential gaps in regards to, like, you had so much data that could maybe, it's hard to kind of pinpoint specific parts, and I'm not sure if there's any other like key gaps that you've not mentioned.
Sure. I think there's a few gaps because drug checking, as I mentioned, has a lot of the time been geared towards kind of festivals, recreational use. There's not that many services, some in Canada and some in Europe, but not that many that are community-based services that try to do what's being spoken about in a Scottish context. So I think we still need to understand, a bit more about what's acceptable to the client group. What are they likely to use? What are they not likely to use? So the research that we've done is really a beginning of that, but it will continue to be built upon. For example, I think our research is some of the only research around drug checking that's looking at specific locations where drug checking could be, and things like that in that kind of detail. A lot of the time it's tended to focus on, because the early research are trying to build an evidence base, it's tended to focus on, would people use drug checking and is drug checking effective, without looking at these contextual things like drug checking is going to be effective if it's in one setting but maybe not in another. So yeah, I think in terms of gaps, it's an emerging field of study, and hopefully we'll keep building on that.
Do you have any like reasons or ideas why there's not as much drug checking services within just the community, and why it is always targeted at the nightlife? Because I think it makes so much sense to kind of have a drug checking service that's in a relaxed, kind of inclusive environment and approach, like somewhere where people don't feel embarrassed to go to. I don't really understand why there's not really community ones in Scotland.
No, absolutely. I think that, I suppose part of it is the way that drug checking arose. It was a kind of harm reduction measure for nightlife and recreational things, which was very much grassroots, with self-testing kits and things like that. So a part of it is that it's always been seen as that to a certain extent. Also, European models have tended to be used, as I mentioned, by like younger people that are maybe only using at night times or weekends and things like that. And that just represents the demographics in that particular country. They don't have the same level of drug-related harms that we have. But there is definitely a growing interest in drug checking for a wider group of people, and perhaps people who are at higher risk of harms, although obviously that everybody's at a risk of harms in some way or another. But so to be honest, I don't know exactly why, but I would say that just getting to the point now where there's a growing interest in the kind of model that's being looked at in the Scottish context.
No, thank you. That was really beneficial. I guess this is kind of open to everyone in regards like overcoming the barriers and stigmas. And is there any worry? Well, that can kind of be the next question. But yeah, is there kind of? I do think there's such a huge barrier and stigma for people dealing with drug use, or I think it's finding that kind of a safe space to speak about it, and there's no judgment. You feel safe, but it's also kind of getting yourself into that space where Because I think taking those steps to go into a safe space to speak to people or peer support groups or whatever it is, the services available, that could be a really daunting. It's taking those first steps, I think, could be so daunting as well. And I don't think there's much support around taking those first steps, but
I can relate to that for sure, Katie. For both sides of the coin, whether it's taking those first steps and what that, starts weighing on your mind. I can also give an example of when things went wrong, is that when I managed to get myself, if you like, into a position where I was determined to go to a place, the one thing I was determined to do before I went to that place was, unfortunately, do as many of what I was taking at that time at once. That led to, effectively, it was overdose and near death. So that's something with our community group, and I see other groups doing the same and trying to do. It's just that motivational interviewing and encouraging, as opposed to trying to say force people to go there. Allowing people to make their own safe choices is so important. Also, I can relate, I guess, to the second part of what you were saying, Katie, in that again, in some ways there'd been a culture that you do a 12-week program, and then you're sort of left. And that, again, I'm not saying that's any services fault. There could be funding, there could be multiple issues for that, but it tended to be this is your set time. After that, you're sort of good to go. Whereas it's now being appreciated that it can be well after that time frame, days, months, years even, something could still happen. So there is benefits to still having some sort of support. And I guess for me, because you see it's a 12-week program, perhaps, or I mean, there's other ones that are longer, there's that need, that imprints on you as well. So then you think, oh, hold on, if I'm not fixed by the end of that 12 weeks, that's a problem. So, I mean, not just myself, other people I've spoken to would then tend to leave because they realized they weren't going to hit this imaginary, unfortunately, fixed target, but not really fixed in terms of recovery. And also people that had completed it, there was then a sort of feeling of, well, I'm fixed. There's no need for me to be doing these things. And then if something did happen, then that's a real barrier, I guess self-stigmatizing barrier in a way, because a lot of these places are very approachable. Certainly all the ones I dealt with, they changed my life. But there can be that, almost a barrier you put up yourself because it's hard to admit. And I think now that discussions have changed, we understand, that can be a lapse. Let's talk about it. That could be a real, let's talk about it. And I think that's the key thing. Let's talk about it. You're not alone. We keep on going, whatever happens. But I think that was certainly one of the ones I can think of, Katie.
No, thank you for sharing. And then, again, this is open to all, but it's like, is there any specific worries or concerns when we're kind of coming into these winter months that it's more challenging? Or just out of interest, is there specific times of the year where you notice it can be harder for people that are involved in drug use if there's more? I just, from my head, I think winter, there's so much additional pressures with Christmas. You've got lots of spending. There's loads of nightlife parties going on. I just think it could be quite a challenging time for a lot of people.
Yeah. I mean, before you go, Danilo, I guess from the lived experience from that side of things, and also for seeing people who we're working with now, a lot of those worries certainly can lead to deaths. Unfortunately, it's a year-round problem. But I think perhaps with things such as mental health, that there's just something with the earlier nights, almost that extension of the darkness that can really start to build up. So the mental health can be deteriorating. People can compensate for that, and perhaps overcompensate due to that going on. I guess it's certainly a factor in winter months.
I don't have too much to add there, Sam. I was just wanting to ask if you see like your work and your organisation as a way of kind of helping with that, and has there been too much focus on services and what services do, as opposed to like community supports that are open to everybody, that can help with perhaps like the darker nights or time at weekends where there's not as much service availability? Is that something that's important?
Yeah, I mean, I think so, and I see the improvement in it from services, and it essentially is one of the main reasons for Fresh Community Wellness starting. Even though we are a community group, we're inclusive to everyone. There was, I felt, a little bit lacking from some places, that it was very much, there was continual options for treating or going into drop-ins or for that sort of thing, but there wasn't activities. I think regardless of what stage you might be, if there's something to focus your efforts on that are not thinking about, and don't get me wrong, I know it's very important to talk about these things, but sometimes it's nice to be in a safe space and focus your activities away from them. And then if there's the added bonus that you can be improving, whether it's your own health or fitness, whether it's improving an area, I think that makes a difference. And it also could hopefully help with some barriers. You know, people might be more inclined to go for a kick around in a park, which is, held in a safe space environment. And it could again help with things like lapses and relapses. So yeah, I things are definitely changing, but I remember being told quite a few years ago when I first started doing groups and things, I was interested in, a walk, would it be possible? And the attitude was very much, well, no, nobody came along last time. And I found that strange, and it's really refreshing to see now that those attitudes are changing. And even if it's, other groups are doing things like gardening, cooking. Yeah, I think it's great to know that you're in a safe space. If you wish to talk about something, or people there may well pick up on things, so you might well go along in the hope that somebody picks up on it. Because again, it can be hard to ask for help, but also the fact that you can do those other activities. And I guess, when people ask if the only thing you've got to say is you went to the drop-in, then that is fantastic in itself. But for myself, and I know from others, that if it's 4 years down the line and you're still not got things to say, and there may be things you want to do, like activities, building up health and fitness, then it can start to weigh on you.
Thank you, Sam. And I guess the next question kind of be looking at what happens, Danilo, when this research is completed. Like, is there like a long-term goal, or what future impacts you do want to make?
Sure. So I suppose our role is to build evidence, collate evidence, share information, and help with dialogue. There's a lot of kind of people that need to be involved in this process, because beyond what we write in our research, there are a lot of different kind of moving parts. There's policing, there's services, resources. So I think that's quite a complex process that will require a lot of dialogue after the research is completed, and we can just help inform that with our research. And I suppose in terms of long-term goals, hopefully share the research findings as widely as possible, and kind of increase awareness about drug checking, and try and get the word out through a lot of different channels. And that's part of what we're trying to do with Lived Experience Group, is we're asking, like, what are the best ways to get this information out to people who might not otherwise hear about it? Can we do talks? Can we do podcasts? Can we do videos? Be a bit creative with it and try and get that message out. And in terms of long-term goals, I don't think this is kind of a personal long-term goal. It's just all the things we've been talking about like shifting values and building trust. Hopefully drug checking, if or when it does get off the ground, can just contribute to that, because I think, and I've been wanting to say this, drug checking should really be seen not as a standalone thing, but as part of a wider approach. It needs to be tied in with all these things. It's not a silver bullet. It needs to be really part of a shift and a more compassionate and kind approach, I would say. I don't know if that really answers the question, but
No, that's perfect. Thank you so much. I don't know if there's any other additional comments anyone wants to make, final statements.
No, for me, just a huge thank you, Danilo, for coming along, and Katie as well. Everyone else, Danilo, any final words?
thanks for having me. I've really enjoyed it. I've never done a podcast before, and I've really enjoyed the chat, so thanks.
Really good. It's been, lovely to meet you virtually.
Likewise.
Good. I feel like I've learned so much today, which is really good.
Same here.